Welcome to In Session by Westside Children's Therapy, the podcast about the real work of pediatric therapy and the tools that help kids find their voice. Whether you're a parent, caregiver, therapist, this is the space where real conversations happen. Each week we sit in session with experts in the field to talk about the work, the wins, the challenges, and the science behind helping kids meet their full potential. I'm your host, Marika Cackett, and I'm so glad you're here. Let's get started. We're in session. Welcome back to In Session, Westside Children's Therapy's pediatric podcast. Today we're talking about a disorder that really affects more children than you might think. 1 in 10 children in the United States have a speech or physical disorder that prevents swallowing, speaking, feeding, and we're going to get into that today with some fabulous guests. We have Rebecca Lonkar, who is one of our feeding specialists and speech specialists at Westside Children's Therapy, Kristalyn Turner, who has been with us for over a decade at Westside Children's Therapy, and of course, Meghan Covey, who is not only a speech therapist, but also specializes in AAC. So to knock things off, what are some of the more common speech-related or language milestones that a parent should be looking for in their child?
So I think one of the first and most obvious things is your child beginning to talk or beginning to speak? But I think sometimes a lot of parents will discount things like, animal noises, environmental sounds, that oh no, like those all count as words, especially when they're young, that 12 to 18 months. Like when we're, counting how many words they have, we're counting all of those. And so I think that's an obvious one. Other things are, are your kids able to follow simple directions, especially if you're giving them gestures, things like that.
Yeah, I think the thing with that too is like our parents a lot, and as a parent of 2 kids too, you focus on like all the verbals a lot, and sometimes that's only part of communication. The pointing, the eye contact, the gesturing, the play base and stuff like that. So I think, like Kristalyn said, like we look for a lot of the verbals and we count that. And the other thing is looking for non-words, we would say, for a meaningful object. Like they say nai for a blanket, but it's used very frequently. To them, that is a word. So some parents will be like, well, they're not saying blanket. I'm like, well, they're calling it a nai, but
they're still communicating.
So they're communicating. So I think with parents, we always want to advise them to let's not hyper focus always on the verbal and look at the whole child and how they're communicating with you, because nonverbal language is over half of the way we communicate. Really? And we kind of miss out on that.
And at what point do you feel like a parent should be concerned if their child's not speaking or, in your case, really communicating?
Yeah, you betcha. And I'll go ahead and take this one. So kind of by age 2, if you haven't heard 50 to about 200 words, this might be a time where you start talking to your pediatrician or reaching out to a community support like Westside and maybe go and get a screener. Because there are kind of these milestones that as speech therapists we look for, and 50 words is kind of the base unit by age 2 that we should have. 50 sounds, whether it's nai, like Rebecca was saying, or like Kristalyn was saying, what other ways are they able to communicate?
So it's not just saying yes, no, mom, dad. It's owie, nai for, or binky for blanky. So we're looking at just general forms of communication, not necessarily English proper spoken words. And I think that might be something that you guys could expound a little bit on for a parent who, says my baby's babbling, but they haven't said mom yet. When should they be concerned?
I think that's another factor too of they might not say mom. And we also look at is that word maybe a little hard for them at the time, but maybe they're pointing and I'm like, okay, at least say no. So you're, again, that nonverbal communication or that receptive language of understanding what you're asking them versus what they're verbally giving out or showing you, which would be that expressive side. I think I always tell our parents, and you guys can correct me if I'm wrong, I always tell them, I'm like, our goal is we want 1 year, 1 word minimum. And that should Meghan was saying, that should grow very, very fast from there. But at 1, they should have some more. But I'm always like, okay, we're starting. We have a jumping off point. So
yeah, and I think just to expand on that, it's really, are they adding to that,
yes,
right? Because that's what we really like to see. So they might be closer to, maybe they're 15 months or so before they get that first word, but does it keep growing from there? Or do they kind of stop? Maybe they just get 1 or 2 words and then not really anything else. So once they kind of start talking, you should really see that build pretty fast, lots of new words every month, and grow from there. But I think too, the other part of it is as Megan mentioned, it's really easy to just go get a screening. So I think if you are concerned for any reason, talk to your doctor, schedule a screening, come in. Like, I'll leave it to a professional to take a look at your child, see what they're doing, ask you questions, kind of figure out what's going on, and then make a recommendation from there. Sometimes we'll recommend that you wait a little while. Sometimes we will recommend that you go ahead and get started.
So for a parent that actually is, thinking about a screening or has concerns, when you say screening, what does that mean?
Yeah, so a screening really just involves you and your child coming in. Sometimes it can be, both parents. I've had people bring grandparents, whoever is concerned in your life or is really involved with that kid, they can come in and we will kind of observe the kid, play with them a little bit. A lot of times kids are going to be really shy when they first come in. That's okay. A lot of what we're going to do is ask the parents or caregivers questions, and then we're going to use that information to kind of decide if we feel like we need to dive in a little bit deeper with an evaluation, or if we feel like they're pretty on track right now.
So that's sort of like an initial sort of assessment. What happens in an actual evaluation where you decide, yes, this child does need therapy or no, and then how you kind of come up with their plan?
Sure.
Yeah, so if a more formal assessment is needed, what that will look like is we would invite the family, whoever comes that day, to be able to come back and dive in a little bit deeper where anything that maybe was seen as, you might hear in the literature, red flag, we would look a little bit deeper. We would bring the child's favorite toys that they were playing with during the screening and look at how are they playing with those toys? How are they interacting with the parent with those toys? And kind of look at an assessment aligned with those toys that they're playing with to see, okay, what areas should we dive into? Because as Becky and Kristalyn were talking about, there are lots of different areas in speech pathology. So there's the areas of pragmatic, so social language, then there's the talking language, the expressive language, there's the language understanding, so receptive language, and then there's fluency. There's all of these other nuances to speech therapy that your speech therapist will look at an evaluation that they only got that kind of cursory look at when they were doing the screening.
Yeah.
And one of the things you mentioned was play. And I think a lot of people get confused, like, well, what is play-based? Or is my kid just playing? But how else are you going to gain rapport with that child? I mean, so, you had talked about having their favorite toy and engaging in that sort of play. Talk to me a little bit about how the play factor, is involved in therapy.
I think play is huge. We learn language. We basically learn most of the language through play. So I think a lot of times parents, when they come to eval, I think their kid's going to sit down in a chair and you're sitting at school. And I'm like, oh no, they are 18 months and they're all over the place. And we're going to let them be there, right where they're at. And we're going to meet them where they're at. If they're playing on the floor, if they want to just dump everything out, but our goal in that is the parents might think oh, they're just dumping it out. They're not playing with it appropriately. I'm looking at how they're playing with it, because we think maybe, let's take a gumball machine. You put a ball in, you hit the button, and it comes out the bottom. Then they should do it again. The kid might dump it from the top and then try to put it up the bottom and then try to hit it and all this stuff. And to me, I'm like, where is their process and thought with that? And then also, if I say put it in, do they understand to put it in? Take it out. They might be not doing it the way a parent thinks they should be, but they're following my command. So you're kind of looking at their language with how they play, and we play a lot. And I think sometimes that gets almost by parents, they're like, well, you're just playing with my child. But we learn language through play, and that's why we always recommend to our parents. I'm like, play, 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 and not next to them, a parallel play. With a lot of kids will do you play here, I'll play here. I'm like, no, get in there, see if they'll follow a command, hide the ball and be like, oh, where'd it go? Are they looking for it? Or are they like, oh, cool, bye. So we kind of look at all of that, and sometimes it could look like you literally are, but we have so many goals embedded in that play that we like to try to explain to parents as we're doing it, but we try our best to also solely focus on that child.
So one of the things I'm kind of guessing is there's sort of two types of delay. You have a speech delay, but then you also might have a language delay. And how do you all sort of navigate one? Is it a speech delay? Is it a language delay? That diagnosis, and two, how then do you treat a speech versus language? Can a child have both, either or?
Yeah, I mean, you could definitely have both. You can have any combination of all kinds of things. And that's why, as Meghan was talking about, we're really looking at everything when we get those kids in for an evaluation. I would say that when kids are young, and I don't know if you guys agree with it, but I think speech delay and language delay are used pretty interchangeably by a lot of people, especially if they're like under 5. But if you're talking about speech versus language, like an actual like speech delay or what we would call an articulation delay are going to be the way that they're producing sounds, the way that their actual speech sounds. Are they misproducing? Are they doing a W for an R? Are they missing their S? Are they leaving certain sounds off? So that is really when we're talking about speech. Language delay is referring to, like Meghan talked a little bit, receptive and expressive language. So in that case, we're talking about how much are they understanding? How much are they using? How do they put their sentences together? Are they following directions? Do they understand the questions that I'm asking them when I'm asking those? And so many more things, but that's
So, and it's interesting, like, I feel like, maybe a lot of parents, when they think of language delay, they really only think of babies. But at Westside, you see kids all ages. Tell me a little bit about so parents watching who maybe don't just have a 2-year-old or a 4-year-old, maybe an older child, the range and the types of speech that you use for different ages.
Yeah, that's a really great question. And when we think about, language and language development, it sort of follows the same trajectory, whether you're, 2 or you're 22. We have to add endings onto the end of words in English in order to make those changes. And whether you're, doing that at 3 years old or you're doing that at 13, there's no real age that you have to do it by. It's what it's recommended by. So we as speech therapists are still referencing those same standards, no matter what age you are. And that can be something like Brown's morphemes. That's a pretty popular one, and that's one that you can look up on your own time. But that is kind of how we're coding language, and language follows predictable patterns. And if you can teach those predictable patterns at any age, then you can rearrange and teach that vocabulary for any person.
What would you say are the most are there certain common, whether they're delays or speech disorders, that you seem to find more often than not?
That's a good one.
I mean, I would say at Westside, we really see like a huge variety.
We are very eclectic in our population, I would say.
We have a lot of different like disorders and, deficits that we treat in speech and language. And it is a very broad, area for sure. I would say we definitely have like a condensely, populated. I feel like our ages really are about that like 2 or 3 until like 7. That's like the biggest part of what we do. And really a lot of that is speech production, working on that articulation, and phonology, and also language, looking at that expressive language. How is it put together? How do those endings go on? All of your grammar, expanding your sentences, describing, and then also your receptive or your comprehension, of language. So really looking at what they're understanding, reading comprehension, and everything that goes with that, being able to ask and answer questions. I would say that's probably like a big majority of what we focus on, regardless of what maybe your primary diagnosis might be. Like those are a lot of things that we focus on. But we also see kids for stuttering. We work on fluency. Every once in a while we see some kids for voice therapy. And for executive dysfunction, and really working on that problem solving, planning. Also lots of social language. So how you use your nonverbal cues, understanding those with other people, and just how to communicate with others, really.
And, as mentioned, you talk about being nonverbal. So I know at Westside, I would say over 75% of the children seeking treatment at Westside are on the spectrum, right? And I think the last stat I saw was 60% of children on the spectrum need some other ancillary service, speech, OT, PT. How do you support, and how do you help kids who are in speech that have ADHD or are on the spectrum? How does that how does that change the way that you work, and what are the sort of the outcomes that, for children that are maybe nonverbal, or how does that change your session?
I'm going to pass it off to you guys because you guys do that. But the one thing I do want to make sure that Westside, we really focus on, even if they have like another comorbidity or something like that, like autism, they might have Down syndrome, CP, which would be cerebral palsy. We always just treat the child in front of us. Their diagnosis might help with them like setting them up and like knowing maybe limits or something like that. But really, it is so individualized for every kid, regardless of that comorbidity they may have. And that does not define them. And that doesn't define how we treat them. It's just exactly who's in front of you. So goals may look the same for two kids with two very different diagnoses, or they might look completely different. So before I pass it off, I just wanted to make sure that we are on the same page, that like that is the one great thing that Westside has. We have a ton of services, and I've been at Westside for over 10 years to be able to work with like other disciplines, but also we truly do treat each individual child regardless of like what else is going on.
One of the things you notice at Westside is it's one-on-one. It's not you in like a classroom of 50 kids. It's you and your kiddo. And that one-on-one, it's truly individualized, tailored treatment to that child. So when you have a child that is on the spectrum or has ADHD, how then are you, for parents that maybe that are watching or listening have kids on the spectrum or are concerned about ADHD, what are some of the ways in which you work with children that are maybe nonverbal for communication?
Yeah, and I can maybe go ahead and take this one away a little bit, but in the scenario that you're talking about right now, we're going to use just a strengths-based approach. What does this child come to therapy that they're good at? Because they're here to learn one of the hardest things that they're having to learn. So how do we make that fun? What are they already good at? And how can we use that as a springboard to teach them the things that they have to be able to do to take what's in their brain and put it out in the world so they can be understood, so that they can tell the world truly who they are in whatever means that is for them. Maybe mouth words or speaking words or verbal communication, whatever way you're going to word it. Maybe that isn't going to be the key to unlocking and showing the world who they are, but what can they do? So is that written communication? Is that pictures? Is that a combination of all of them? Is that pointing to things? Is that bringing my hand to you? As a therapist working with children who identify as non-speaking, it's show me who you are, and then I'll help you navigate the world by showing you all these cool tools, and then you can pick what your voice wants to look like.
I was very lucky to be in a session with you with two people who are nonverbal, and I will say we danced. We jumped. We had an amazing time, and one of the kiddos did always put their hand to their face, and another one who was nonverbal communicated with their eyes, which I thought was incredible. And in a future episode, we'll talk about kind of how AAC is involved. But one of the things I was thinking about when you talk about ways kids communicate, I feel like kids today are born with like a cell phone attached to their face. Like they have an iPad, they and you wonder like how is that really affecting speech with kids that are, they're so digital. So how do these, time spent on digital devices, is that affecting negatively speech delays or, speech development? I would just be curious to hear your kind of thoughts on that.
Well, I can take a little bit of this too. And for someone that puts AAC devices or helps get them in children's hands so that they communicate, there is no research saying that it is going to negatively affect communication development. And if we're talking about AAC devices in particular, it's only going to help communication. So that being said, if we're talking about other types of media and tech, it's just figuring out how to integrate that into your daily life where you're also pairing that to the real world. So I don't know, if you're playing a game in Roblox at home where you're following a snake around, then you want to find a snake toy in real life and maybe bring that play schema that you're doing on the tech into real life so that you're teaching both skills for generalization.
Yeah, I would say, I'm sure this is it's a really hot topic, It is. And I think as a parent, you have to do whatever you have to do, Sometimes you just have to get through the night or the day or the week, whatever it might be. But I think as long as it's not completely replacing you spending time with your kid, modeling language, reading to them. Please read to your kids.
Yes, every night.
Please. That is probably, if there is one thing that you take from this and one thing that you could actually do implement immediately, read books to your kids. That has been, researched and shown to make the biggest difference.
Yes.
But aside from that, you really, as long as you are still spending time with them, interacting with them, when they're having, their alone or solitary playtime, yes, it's great to play with toys and learn how to problem solve and learn patience, and all of those things are learned away from a screen. But that's not to say that spending some time on screen is going to specifically cause a delay.
Yeah. I would say too, I think parents sometimes take, we kind of forget that we're their biggest model. So if we're on our phone, they see us on, they just want to imitate what we're doing. And sometimes they don't want the device. They just are like, I want to be like mom. I want to be like dad. So sometimes I'm like, even when you're cooking, give them exactly what you're, if you want silicone utensils, so they're not like beating them against your cabinet or whatever. I've had 2 little guys, so I know how it is, but have them imitate what you're doing because they're following directions. That's all forms of communication, but you are their biggest model 24/7. And I think sometimes you need your space, they need their space. Like you said, so yes, there's a time and place for everything. And we're never, ever going to judge a parent because it is about survival some days. I've been there myself. But we just want to use it as functionally as we can with that appropriate integration too.
Well, and that was kind of my next question. So how do you involve a parent into the therapy process? Number one, read to your kids, people. Every night, read to your children. So other than reading and having them model, but how else can a parent really be involved in their child's therapy?
Yeah. And it's figuring out, okay, what does your home look like? What do you do after school? Do you go home and play iPad for an hour to decompress? It's not about changing your home life per se, but it's taking what you're already doing and how do we embed some therapy supports of what you're already doing. So, if it is playing on the iPad or something after school, we'll join in. Maybe there's something cool that you guys can be doing together. Or, hey, at mealtime, maybe there's this really special moment that we can embed some feeding skill or some other social interaction ability at the table.
And that's something too, we'll get into another episode that speech isn't just verbal. I mean, there's feeding, there's AAC devices that, you've talked about. One of the things in particular that stands out to me was observing a session with a young man who loved Megan Fox, who absolutely loved the actress Megan Fox. And he was nonverbal but in addition to, because he loved the Ninja Turtles, right? And she was in the movie. But one of the things I thought was really cool was in their home, they cuss and it's okay. And they wanted to make sure that he felt he could express himself the same way. So really on his little AAC device, he has some choice 4-letter words. It was awesome, especially it was pretty cool. So tell me a little bit about, having a child and again, bringing them into just because they have a speech delay doesn't mean they can't communicate the way that your family does.
Yeah, and I think that's part of too. You'll hear a lot about child-led therapy, and that really doesn't mean that the kid gets to do whatever they want while they're with you, right? But it does mean that we're letting them lead the way, and then we're finding a way to incorporate their goals, to structure their session, and follow their interests. Because if they do not want to be with us and they're not motivated and they're not regulated, nothing is going to happen in our session. No learning is going to take place. And so I think that's a great example of that was definitely a child-led, family-led session. We took, into account what is this child's special interest, what are they really into, what is going to motivate them, and use that to help him figure out maybe how to use his device or how to navigate that a little bit better or how to put longer sentences together. And that's really, what it's about.
I think a lot of people are still, we are obviously a few years outside of COVID, but they're still talking about how COVID affected children in development. And you have COVID babies now that are going into kindergarten. Are you still seeing an effect from that? And are there things that parents who, had their children during COVID should look for?
I did have a COVID baby, July 2020, and she is going into kindergarten this year. So I think just by nature, knowing we weren't able to play with friends. My family is a very social family. So we couldn't really do a lot of that. So we did a lot of playtime at home. However, I was blessed as in we worked from home too, but like I got to incorporate my kids almost in our teletherapy because we switched to teletherapy. That did not happen for a lot of families. And I think at that time, it was almost, both parents were working at home. You're trying to still play with your kid and have them here and get everything done. It was a very stressful time for everybody. So I think moving forward, at that time, as we had a lot of coming out of COVID when we were back in the clinic of like, is it autism or is it just lack of exposure? And we fought this battle, and I think sometimes we still do for quite a few years after COVID. Like, are they showing signs of this? Is it just a little delay? Is it just exposure because they weren't allowed to be around to be other kids? Maybe mom and dad both had to work. It is nobody's fault. You do the best you can every day.
I think that's like the parents' motto. You do the best you can.
That's what I live
every
off
day.
of every day. I'm like, you just live daily and you do the best you can. It's all about surviving. And that's why Meghan brought up the point that we meet their parents, like where they're at in their household. Like if I know when we talk about feeding in future episodes, like they're never going to shut off the TV, I'm never going to ask them to shut the TV off because it's not going to matter. That's your culture. Let's meet you where you're at. How do we work around it? But back to COVID, I think when that happened, like we just had to be more, we had a lot of more speech delays like coming in our, basically in the office, and it was more like a lot of exposure stuff. So we almost had to like double time it and give a lot of parent education, but then the whole world also switched. Now everybody was at home. So it kind of changed our approach to on like, how many tools can we give you? What's realistic? I think in my mom brain, that's why I went like, what is realistic for this family? I can't ask you to play on the floor with them for an hour. You don't have an hour. Let's do 10 minutes. Let's do this. Let's make dinner together and work on using our words or something like that. So you guys can add on that too. But I feel like it just changed our approach of like really like, what does home look like? What is easier for you? Let's meet you where you're at.
And I think too, with COVID just happening, there was a shift in service provider abilities. So now there is an option for teletherapy coding where, before COVID, that wasn't necessarily an option, or it was much less talked about. So there are some real positives, I would say, that came out of it because now speech services can be more accessible to remote areas and things because of teletherapy and tech. So for all of the difficulties that some families might have faced in their homes, there are some other ways to get services and things coming out of it.
And you mentioned this talking about really being a mom and having kids and then being a speech therapist. For these moms and dads and caregivers listening, and they think, I think my child needs to be seen. What sort of attributes do you want them to look for in a speech therapist, and that, what should parents look for in a good speech therapist? Because it's not like you just call a number and, parents, they do their research. So as parents sort of research this and look, what are the attributes of a great speech therapist that you all find, not just at Westside, but just in your field in general?
As a parent, I would say more like, it's so hard because we have so many great therapists in our field. Most of us are very loud and bubbly, but not all. And I think the other thing is you just have to look at someone that's going to pair with your child. It could be like my son, he was not but for OT, and he had a male therapist to start, and like he gravitated very well towards male therapists, and I didn't know if he would. So I think it's just a therapist that like bonds with your child. And truthfully, sometimes that's not going to be everybody, but it's more of just their approach with your child. Like I always tell my parents, I treat your child when they walk into my door just like I would treat my children, because I want the best for my children. So I want the best for your child. But it's just kind of like that match. Sometimes it's like a match you wouldn't think. It's like a really cool, calm therapist, and your kid's like, one of our busier friends, and that's what works for them. And sometimes you need a therapist that's like just as busy as they are, and you're like, who's in that room? And they're like, woo, it just really depends on that first bond. Because I always say with the therapist, like that bonding is so important, because if they don't build that trust bond, you can't manipulate their environment. And if you can't manipulate their environment, you cannot make progress. So that trust has to be there. So attributes are really hard. It's just like what the relationship is, I would say. I don't know if you guys want to comment on that as well.
Yeah, I would say that is probably the most important part of it for sure. I think outside of that, it's not necessarily specific like character attributes, I would say, but you do want someone who you feel like is listening to you, and someone who explains things well to you in a way that you can understand as a parent. I think that's probably what makes that whole relationship work.
Yeah.
And, at Westside, you see so many kids, and you've obviously you've been a therapist for years. Do you have certain success stories that just sort of stand out that one or two that you can share, that just something really special? Because I think, parents in this situation, they might feel hopeless, and they want to know that success stories are out there. And also, I think that's defining, like, what does success look like?
I think it can be really scary to have to ask for help as a parent myself too. Just knowing, like, hey, maybe things aren't going along the trajectory that they're supposed to be. And even knowing that there might be a red flag, that can make your heart hurt as a person. And so you want to find a place where the people around you don't make your heart hurt anymore, and they give you hope instead. And so that's what I hope that we do at Westside, one, and that is where the success stories that I have kind of come from. It's providing that hope to parents. So, off the top of my head, and some AAC evaluations that I've done, showing children how language works and having a child tell their mom for the first time, I love you. I mean, those are the moments that you can't make up, and they're the ones that, if a parent isn't sure what they're supposed to be doing, having your child tell you that for the first time that'll
Amazing.
show a parent that that's the right thing for my kid.
Yeah.
Yeah, I mean, I think that I really like to make sure that I have not only like developmentally what I think is next for this kid, where I think they should be working, but we make sure to include the parents. Sometimes when you talk to them, their goals are a lot different than what my goals for that kid might be. And so making sure to find that you, have a place in the middle, and that you're working on what they need to do, or you're explaining to them, like, I love that your goal for them is to be able to have a conversation, but here's where we need to start, and this is how we build to that. And I think just never telling a parent that, like, well, they're not going to do that. Kids have so much potential, and there is just no way to say that they won't be able to do something. But on the other side of that, I also can't tell you when. So you have to be patient and just know that we're in it together, and know that, I'm working for whatever you are working for, but it might take us some time to get there, or at some point we might have to shift and, come up with a different game plan. And so I think, without a specific story, my biggest success stories are really when you get on the same page with that parent and you see them implementing things at home, and they are coming back and being like, oh my gosh, they did this, they started pointing this week. Or, like, they said mama for the first time, or whatever it might be.
Yeah, I would agree. Yeah, I absolutely agree. When you, like, find that relationship with a parent, because I feel like that's where you made that, like, almost happy marriage. And it's like everybody can kind of move forward, because when they walk in your room, you're like, I'm looking at this, they're looking at this. There's a lot of factors, and you're trying to give them a nice puzzle to put together the best you can. But I think how you said, like, well, what defines success? I'm one of those also, like, small wins are huge. And I always point it out to my parents. Like, one of the biggest things I remember, we had a kiddo that was non-speaking, and they were like, they just don't know what they want all the time. And I'm like, well, their behavior, they're communicating with you. They think that's easy. You don't, but they think it's easier to, barrel roll on the ground because they're not giving you what you want. I was like, get up and ask for a high five. We know they could do it. And then give them the option, or just give them both. That's a form of communication. They looked at you, high five, here you go. You just had an exchange of communication. So I think breaking down those small wins for parents and knowing, like, we are with you 100% of the way, but small wins are huge, because those are the stepping stones to keep going and going and going and going.
I love that. Do each of you have a certain, whether it's a website, a book, and we know, read to your children. That's like, if we don't get anything else, read to your children every night. But is there a certain book or tool or just something that you find impactful, either in your practice or that you recommend parents for speech therapy?
I think we kind of talked about this too. I think the biggest thing, we'll all kind of say yes, books. You don't need to go buy the $50 toy to, like, get your child engaged. My favorite toy is bubbles. I love bubbles. I use it for feeding therapy, speech therapy. You can buy them at the dollar store. You can make them at home. You could work on so many things with bubbles of opening and closing. Also on the feeding side, the opening something, closing it, the wrist rotation, kind of those fine motor skills at the same time, but working on blowing, breast support, but also like more, all done. Uh-oh, if they dump it out, I mean, bubble wands last like 5 seconds typically because they're like, cool, and you're like, oh, that was great. So they're learning all of those things and it seems like it's so simple, but you could probably do a whole 40-minute session with just one bubble wand if you really wanted to, if they liked that. But don't go buying expensive toys. There's so many easy things you can use that they're engaged with, but that's my favorite.
Books, bubbles. Got it.
Yeah. I would say similarly, I think the most important thing when you're looking at picking out toys for your kids, and rather than trying to just get them something you think they would enjoy, get something that you would enjoy doing with them. Because the whole purpose of this is the engagement with them. We want you modeling language, we want you to be at the table with them or on the floor with them and enjoying it, because they know if you're not. They can tell if you don't want to be there, if you're not having fun. And so I really love Play-Doh. It's one of the easiest things. And it's so versatile. Use a couple cookie cutters, or you could even use some of those like kid knives that maybe you have in your kitchen already. Make it into different shapes. There's the language that you can use with Play-Doh and the activities you can do is endless. And so that's a really great one. And if you have a kid who's eating it, you can make your own Play-Doh. You can use flour, salt, and water, make your own Play-Doh, make it any color you want. Just have fun with it.
And it's non-toxic if they do eat it.
It is non-toxic.
It's non-toxic.
Yes, yeah.
And I think for me, one of my favorites is using a balloon, because there are 1 million things that you can do with a balloon. It's up in the air, it's down, you can make it bigger, you can blow it smaller, you can shoot it across the room, you can use a pumper to pump it up. So I like any toy where there's a lot of things that you can do with it. And like Kristalyn and Becky said, something where it's flexible and the family enjoys it. You've got to enjoy doing this too. So I guess this is two, but I also just really like building forts. So some blankets and crawling and making little spaces. Do we make it bigger? Do we make it smaller? But anything where there's that interaction or that kid finds joy in it.
I think engagement is the name of the game.
Yeah.
Well, thank you, ladies, so much. We appreciate you coming on our inaugural podcast of In Session, and we will see you next time when we go In Session.